Has your knee become so swollen that your doctor had to remove the fluid from it? For a few days, it felt better. Then the swelling came back. Why does that keep happening? If that's happened to you, here's what most people are never told. The fluid was never the real problem. That swelling happened because extra fluid collected inside your knee. Doctors call this synovial effusion. But you don't need to remember the name. What matters is this: synovial effusion is not the disease. It is a sign that the lining of the joint, called the synovium, has become activated. That lining becomes activated for a reason. It can be cartilage breakdown signals, a meniscal tear, bone stress underneath the cartilage, mechanical overload, weight related and metabolic inflammation, crystal disease or gout, or infection, less common. Once activated, the synovium releases inflammatory chemical messengers and produces extra fluid at the same time. The fluid isn't the disease, it's the smoke. Synovitis is the fire. And until you understand what's feeding that fire, the smoke keeps coming back. மூட்டுக்கு உள் எரிச்சல், the fire inside the joint. Here's something that surprises most patients. An actively inflamed synovium is often associated with more pain. The amount of fluid can contribute, but it is the inflammation behind it that matters most. Active synovitis is one of the strongest predictors that osteoarthritis may continue to progress, often more reliably than the X-ray alone. In fact, MRI studies have shown that synovitis may appear even before significant cartilage loss becomes visible on an X-ray. That is, MRI is more sensitive than X-ray, and it is one of the first studies to show cartilage loss and synovitis. That is why two people can have the identical X-ray and completely different pain. Your scan does not equal your story. The knee is not cartilage with some other parts attached. It is cartilage, the bone underneath it, the synovium, the meniscus, the ligaments, the fat pad, and the immune cells inside the joint. All of them talking to each other. The synovium sits in the middle of that conversation. It doesn't simply respond to inflammation, it can also amplify it. And in many knees, it starts sending out alarm signals before major cartilage loss is even visible on a scan. It isn't only the last stop, it can be one of the early drivers. Here is roughly how it runs. Cartilage releases danger signals. The synovium becomes inflamed. It produces excess fluid and inflammatory messengers. These affect the cartilage and the bone underneath it. The stressed bone sends out its own signals. The synovium becomes even more active. Think of it like a kitchen where the smoke alarm won't stop going off. Each time it does, the kitchen sends out firefighters. That's the inflammatory activity, and the firefighters spray water. That water is a fluid you keep seeing drained. Mopping the floor doesn't put the fire out. You have to find out why the alarm keeps ringing.
The burner is still active!
PRASAD is not aimed at drying up the fluid. That was never the target. What it targets are the tissues that keep sending the alarm. Synovium, cartilage, subchondral bone marrow environment. PRASAD is designed to improve the biological environment of the whole joint. Reducing the signals that keep the synovium activated, rather than treating the fluid as if it were the disease. When the inflammatory drivers are reduced, the synovium has less reason to produce excess fluid. This is the biological rationale behind the protocol. It is not a claim that PRASAD has been proven to eliminate every knee effusion. The right treatment depends on why your knee is producing the fluid in the first place. And that's assessed case by case, not from a phone call. So the next time fluid builds up in your knee, the real question isn't how do we get rid of the fluid? It's what's still feeding the fire.
Let's review your MRI scans together. Everything looks perfectly normal here. You are making a full recovery.
If this has helped you understand your own knee a little better, subscribe. Next up, we look at why some knees age faster than others.